Hey guys, this is Honest Birth Talk, and the topic of conversation is what to expect when having twins, and what are some things that you actually encountered when you were having your twins?
All right, so this is kind of a complicated thing, but one thing to expect is people may treat you a little bit like you have a disease instead of like you're having babies. It's really hard to overcome that idea that this is a high risk, out of the normal pregnancy, when in fact having twins is just a variation of normal. So that's something that you may find challenging and you have to overcome. You may also experience a little more morning sickness. I did. I was a little sicker with my twins than I was. The symptoms hit a little harder. You'll show earlier and probably gain a little more weight than with a singleton, so that's something to expect. One of the big things is repeat ultrasounds. You'll get more ultrasounds, or your provider may want to do more, but again, this is your body and your choice. And so if you'd like to dial that back a little bit and talk to your provider about managing your pregnancy as a normal pregnancy instead of like your sort of broken, there's a lot of focus on those new babies and a little less focus on you. So again, having clear communication with your provider is super important because you're pregnant with twins and it's actually pretty normal. So you can have that open dialogue. You may experience more pushback. I will just say you will experience more pushback on wanting to have twins naturally or vaginally instead of opting for that scheduled C-section. But it's totally possible, and it's actually recommended by the ACOG to let women with twins to have a trial of labor and try to have those babies naturally. If you are birthing in a hospital, they'll want you to birth in the OR, even if you are trying to avoid a C-section. And some other things you might experience is pushback on wanting to breastfeed twins. We cover that in another video. It's totally possible, and I promise you'll have enough milk for twins. What's some other things, Michaela, trigger my mind?
The one thing that I would say with all of this is, yes, you might have some more obstacles or hoops to jump through if you're pregnant with twins, but with the proper education and communication with your provider, it's absolutely possible to be in the driver's seat during this pregnancy, as opposed to having everything thrown at you. You might feel a little bit more fear-based if you're having twins than a single pregnancy. But really, there's a lot of resources and tools out there to help you have a wonderful experience, just like when you're pregnant with one.
And I would say that even if you face an obstacle, one of my obstacles was needing a cerclage, which is a procedure to help carry twins longer so that you don't go into preterm labor. That doesn't mean that you're broken and that things are just completely off the rails. It's actually kind of common for twins, especially if you're petite and small and carrying all that weight. It can lead to some minor things, but again, you just have to have open communication with your provider and be educated in knowing what you can do to further your pregnancy, get your twins farther along. Sometimes twins are born early, so knowing what that may look like week by week with your pregnancy and what goal weeks are. Most providers want twins to be born after 36 weeks, if possible, and just be ready for those types of things. But you can carry twins to 40 weeks. It's totally possible, and I would say something we're passionate about is your nutrition. It greatly impacts whether or not those babies are going to make it to term or not. So.
And that doesn't mean you have to eat more because you're pregnant with twins, but instead it's about what you eat.
Yes, absolutely.
All right, thanks.